Hello, my name is Jeff Schuessler. I'm an interventional cardiologist on the medical staff at Baylor Scott & White Heart and Vascular Hospital, Dallas. Today we're going to talk about coronary artery disease. The American Heart Association estimates that over 16 million Americans are living with coronary artery disease. It's the #1 killer of both men and women in the U.S., so it's important to not only understand what coronary artery disease is, but also learn about risk factors, identify the symptoms, understand how it's diagnosed, and explore treatment options. Coronary artery disease is also known as atherosclerosis. It's the narrowing of the arteries that carry blood to the heart due to cholesterol plaque buildup. The more plaque that builds up within the artery wall, the more narrowed an artery can become. When blockages become severe enough, the heart may not get the oxygen it needs, and this can cause chest pain, which is known as angina. In some cases, the plaque can rupture and shut down the artery, which is known as a heart attack. Some of the symptoms of coronary artery disease include chest discomfort or chest heaviness, which is also known as angina, shortness of breath, nausea, or sweatiness. Should you experience these type of symptoms that are not going away, you should call 911 and seek immediate help. To diagnose coronary disease, your doctor may conduct a history and physical exam as well as blood tests. They may also suggest one or more diagnostic tests to be run. Some of the diagnostic tests include CT coronary angiography. This is a CAT scan of the chest timed to look at the heart arteries. It can diagnose the presence of, and in some cases severity of, blockages in the heart arteries. An echocardiogram. This is a test that uses sound waves to look at your heart muscle function. This can show how well the heart is pumping and also whether or not a valve is narrowed or leaks. It does not look for coronary blockages. A stress test shows how the heart works during physical activity. Because exercise makes your heart pump harder and faster, you may either be on a treadmill or a stationary bike. This test can reveal problems with the blood flow within the heart, and it can be done in conjunction with an echocardiogram or nuclear tracers to give more information about the pumping function of the heart. Common risk factors for coronary disease include, but aren't limited to, diabetes, smoking, family history of heart disease, high blood pressure, also known as hypertension, high cholesterol, or obesity. When diagnosed with coronary artery disease, your care team will work with you to determine the best course of action for your specific condition. Your treatment will be determined based on factors such as age, medical history, type and stage of coronary disease, as well as personal preferences. Changes to your lifestyle may help reduce the overall risk of coronary artery disease. Your doctor may advise you to make heart-healthy changes such as quitting smoking, maintaining a healthy weight, increasing exercise or physical activity, and eating a heart-healthy diet. In addition to making heart-healthy lifestyle changes, your doctor may also prescribe medicines to help treat risk factors of coronary artery disease. Some of the most common medications prescribed include statins, which decrease the production of cholesterol, medicines to lower heart rate, and medicines to decrease your blood pressure. If your doctor thinks that a blockage is likely, a minimally invasive test called a cardiac catheterization, also known as a coronary angiogram, may also be recommended. During this procedure, a long, thin, flexible tube called a catheter is inserted into a blood vessel in your arm, groin, or neck and is threaded into your heart arteries. Once there, contrast is injected into the arteries to help visualize if they have any calcium buildup or blockages. In cases where blockages are found, treatments, in addition to medications, can be used to correct those blockages. Coronary angioplasty and stenting, which is often done at the same time as a coronary angiogram, is where a small balloon can be inserted into a clogged artery and open it. Very frequently when angioplasty is performed, a small mesh-like tube, known as a stent, is placed into the blockage to keep it open. Coronary artery bypass grafting, also known as CABG, is a surgical procedure where a new path of blood flow is created around the blockage, a bypass, so blood can get into your heart. The surgeon may take a section of healthy blood vessel from your arm, chest, or leg and use it as a graft to go around the clogged artery. Minimally invasive cardiac surgery, also known as keyhole surgery, involves creating a small incision in the side of the chest where surgeons pass a small surgical instrument to correct coronary disease. This can be used for bypass surgery and often for valve surgery. Baylor Scott & White Research Institute and the Soltero Cardiovascular Research Center oversee a large number of cardiovascular trials and studies. If appropriate, your specialist may recommend taking part in a clinical trial. Baylor Scott & White Heart and Vascular Hospital, with locations in Dallas, Fort Worth, and Waxahachie, are award-winning hospitals dedicated to and specializing in heart care. Many times these hospitals are the first in region, state, or country to offer new procedures and devices giving patients access to the latest treatment options faster than other centers. Find a cardiologist today by visiting bswhealth.com/heartdfw or by calling 214-820-7162.